Dr. Taggy here, and I would like to talk about a topic that is so important and so not spoken about, even in the holistic health, and this is scars. Scars to me can cause so many problems. I've seen it literally mimic heart attacks in patients. I have a patient that is a child that was vomiting after every meal, and it was because of a scar in her heels. And the moment we healed it, it went away. The nausea and the vomiting went away just by treating a scar. I made a whole podcast with Leslie Rubinoff. I will put the link below that talks about why scars and scar tissue can block the meridian lines and block the healing. They literally act like a roadblock to the area. The scar tissues are dead tissues that block the healing to the area. There is no blood flow. There is damage to the nerves. There is nothing coming to the area to heal it. But even worse, it would redirect the waste to other areas that don't have the manpower to do that. So for example, a C-section scar would literally cut your body in half. So you don't have the blood flow coming down, and it will cause a lot of problems of the blood flow, the waste going back to other organs. Same thing for thyroid scars. So if you have a thyroid scar, you have those scar tissues that not helping the other part of the thyroid that might still be around, or your parathyroid, causing a lot of problems in the area. So the two type of scars that I see a lot is the visible scar, the scar that you know it's there because it left a scar behind. So that will be something like I mentioned, a surgery scar, or it will be something like you had a wound, or you had a trauma or an accident, and it left a scar behind. And then there is the invisible one. The invisible one is that you cannot see at the naked eye. But if there is any tear, if there was any tear opening to your skin, that can cause a scar. It can even be from dental work. It could be from vaginal tearing after vaginal birth. Even piercings. Piercings are considered scar. Tattoos are considered scars, and even any laser treatment. So if even the laser that I see that more and more people are doing for hair removal, that is considered a scar. I'm not saying don't do them. I'm just saying make sure that you treat your scars, which brings me to how to treat your scar. How to treat your scar, I'd like to treat them three ways. Orally, so by taking something orally to help with the scar tissue, softening the scar tissue, helping with reestablishing the blood flow and reestablishing some of that nerve life in the area. So we are basically healing and we're removing that block. I also like to treat them topically. The way I like doing it topically is through oils that are very high in vitamin E. I really like Soothe from the blend, and any kind of oil that's high in vitamin E, wheat germ oil, sesame seed oil, argan oil, or you can also buy just the regular vitamin E supplements, and in the little gel capsules that you can poke, and that's why they're fresh and not rancid. But if it's a large area, go ahead and just use a big bottle. Orally, I really like gotu kola as an herb that also helps with blood circulation, and I like scar and adhesion. What I like about this one, it doesn't taste like anything, so you can also use it orally. I usually make my patient use it orally, but also put it over the scar area. Last but not least is laser therapy that helps with the deep tissues, goes deeper into the skin than the topical model. So I like this type of laser therapy. I use this a lot for small areas that I have control over. So that would be like if I have any dental work, or if there is a small scar, I would use this. Otherwise, if it's a larger area, I have a belt. So I use this actually a lot. I use it for pain. I use it for cramping. I use it a lot over my uterus. I also, with my first baby, I had an emergency C-section. So I'm basically covering all of my ailment in this area with this light right here. And this is from Life Pro. I am obsessed with this company. I love them. I got the laser from them. I got this from them. You can wrap that. I have some of my patients that wrap them around their back if they had any surgery there, or around their knee for knee surgery. So this is very practical. Last but not least is a red light therapy panel. This is from Life Pro as well. Be careful, it's gonna be super bright. But that's basically for any large areas that you may not have control over, and you don't want to be sitting there for 5 or 15 minutes, you know, doing it, but this is really great for smaller areas that these cannot reach. So let me know if you have any questions about scars. I'm gonna say one thing before we go is the most detrimental scars are the scars over organs that sit on organs. So if you have a tattoo that's sitting over your chest or over your uterus or over, you may want to be treating that one. If you have a horizontal scar, so scar that basically cut the meridian lines. The meridian lines are vertical, or they are, you want to make sure that you're treating that one. Will be scars in here, under your breasts, over your uterus, or in your ankles as well. All of those are more detrimental to me than any other ones, and the ones that are over organs because they're stopping the flow to that organ. And the last thing I also want to say is making sure that if you're using anything topically, to warm up the oil if you can. So the warmth helps with the absorption as well. You can do that as often as you need, and there is not such a thing as an old scar. I've seen scars from 30 years ago. Like, I've helped women through menopause because of their C-section scar or their vaginal tear of 30 years ago, and treating that scar has helped that. So it's never too late. Start, if watching this video makes you think of scar, treat them. You have nothing to lose by treating a scar. So part of my regimen after every shower is using a vitamin E oil, and I make sure to put it on any area that I think I have a scar. I just lather my whole body with it, and this way I'm covering all of the areas that I may or may not have a scar. Let me know if you have any question. I hope you found this informational. Bye.